Good afternoon, future nurses. So today I wanted to show you guys a nursing teaching plan. When I had to do my first one, I couldn't find any examples for free online. So I wanted to show you all one. And my school, they didn't really want to give us an example either. They just simply said follow the rubric. So here's an example. And on this particular teaching plan, I got a 96 on this one. So make sure you absolutely follow the rubric because it includes things outside of this actual teaching plan, like as far as presenting to your patient, using different handouts, and different teaching techniques. Okay, so let's start at the top. So at the top, you of course want to include your name, your teaching, and then over here you want to include the patient's room and their initials and the date. And in the topic section, you pick a topic. I picked Indwelling Foley Catheter Care. So you can pick whatever your patient needs. I have another teaching plan that I did on mouth sores because sometimes patients with cancer, they get mouth sores. So I had mouth sore care. You can do oral care, just regular oral care, exercises. If you want to teach them range of motion exercises, or if you want to teach them about nutrition, it's a bunch of things you can teach them about. So this is the first box, the topic. Then the second box, you have to put the need for teaching. So I put the first time having an indwelling catheter that will have to be in place for 2 weeks. So you have to think about the need of why they need to be taught. Usually you can just put like their first time or the patient's unfamiliar. And then in this third box, you have information about group learners and barriers of learning. So you put a little introduction about your patient, their age, their diagnosis, and then you also put like their medical condition, which you know is different from their diagnosis because you can have your nursing diagnosis and then their medical diagnosis. And then you put their language because you know you need that as far as communicating goes and teaching. And you also just put like a little history of what's going on with your patient. So I put patient has just been admitted to the emergency room stating that he was unable to urinate for 2 days and was feeling bloated and pain in his lower anterior abdomen. Patient shows some signs of anxiety and states, "Help me." So I know on my most recent teaching plan, some feedback I got was that in this session, you should include specifically like barriers, what different barriers that the patient may have. Like if they are very fatigued and you have to teach at certain times of the day, or if they have a hearing deficit or they're blind or, different stuff like that. So anything that would be a barrier for learning. And then for the learning readiness, you have to like assess your patient's readiness. So if you do a teaching plan and you go into the hospital and you meet your patient and you learn about them and you think about what you're going to teach them, you have to listen to what they tell you and also kind of question them to assess their readiness to learn. So right here I put a quote. Patient stated, "I am ready to feel better and want to know all I can to improve my condition." You can ask them, "Is it okay if I teach you about such and such tomorrow?" And they say, "Yeah, sure." And that can be your readiness to learn. And then, of course, you include your references. Make sure you put them the exact way that the rubric says. If they want APA format, put that. If they want 2 extra resources or 3 references, put that. Make sure you just do this section exactly how they ask for it. That one's pretty simple, the references. And then this is your goal. So you want them, well, in this situation, I wanted my patient to be knowledgeable about Foley catheter care. And I don't know if this is big enough, so I'm just going to make it bigger so we can look at it. So knowledgeable about Foley catheter care, consumption and practices to help with urinary elimination to prevent bladder distension, infection, and urinary stasis. So you put the goal and then the reason. So I want them to be knowledgeable so that they can prevent bladder distension, infection, and urinary stasis. And you always want to include the date you want it completed and the time. And sometimes they have you sign it as well. And then for the objectives, I came up with 3. These are basically different things that will help you reach your ultimate goal. So if my goal is to have my patient to be knowledgeable about Foley care, then my objective would be patient will know fluid intake requirement of 3,000 milliliters and importance of required fluid intake. And then I put the date and time. And If they know the fluid intake requirement, this can help with their catheter care as far as keeping it clean and flushing the bladder out and flushing the catheter out. You need to have adequate fluid intake to prevent urinary stasis and just promote urinary elimination and just getting rid of that bacteria that's inside of the bladder. And then my next objective was patient will know what foods to eat to acidify urine and importance of acidifying urine. And then I have the date and the time. So this also goes to, because basically the whole goal is to prevent infection. So if they have acidic urine, it can decrease the chances of bacteria being present in the urine and decrease the chances of infection. And then the next one is patient will know how to maintain an indwelling catheter, including hand hygiene, avoiding kinks in tubing, how to empty the drainage bag, and when to contact his provider. And then I have the date and the time. So this one is a loaded one. You could have just did one. Like I could have just put patient will know how to maintain an indwelling catheter, including hand hygiene. Or I just could have put avoiding kinks in the tubing. But all of this is contributing to making the patient knowledgeable about Foley catheter care. So all of the objectives, they're all different things that help us reach our goal. And then for teaching strategies, this is what I was talking about before. So you have to include a teaching strategy along with the domain that it uses. So the first one I have is one-on-one discussion, and it affects the affective and the cognitive domains. Next, I have demonstrate skill, which affects the psychomotor domain. And then I have printed and audio-visual materials, which affects the cognitive domain. And if you have the Kozier and Herbs Fundamentals of Nursing book, I'm going to include the page number where you can find all the lists of different teaching strategies and their respective domains. So you can just pick from that list when you get to this box. Next, we have the learning activities. So in this section, you connect the teaching strategies and the objectives. And so I put the learner will have one-on-one discussion and identify the amount of fluids and acidifying foods to eat, importance of drinking 3,000 milliliters a day while having a Foley catheter. So this includes the one-on-one discussion, which is the teaching strategy I have here. And then it also includes the fluid intake requirement and also what foods to eat. The learning activities, it draws in what the actual patient will do, and it just includes, the teaching strategies and the objectives. My next one, I put demonstrate hand hygiene, emptying drainage bag, and keeping the bag below the level of the bladder, and avoid kinks in tubing. So this one includes the teaching domain, demonstrate skill, and then it has my objective, including hand hygiene, avoiding kinks in tubing. And then lastly, I have patient will review bladder bowl community catheter care brochure and ask any clarifying questions. So this is the teaching strategy of using printed and audio visual materials. You want to include some type of learning aid, because I know that was part of our rubric, is including an actual learning aid. Like you got points for including a learning aid. So it is best to always at least have this teaching strategy, the printed and audio visual materials, because you get points, for having it here and also for using it with your patient. Next, you'll have your content. So actual content is the outline of the material that you're going to actually teach your patient. You may not want to have so much content. So I have 7 items here. This is kind of a lot to teach a person that's sick at once. And when you do your teaching plan, you're going to teach them that one time, you're going to give them a presentation. So you kind of got to consider, like, how much would you be able to listen to and remember? Because you have to evaluate whether the patient learned what you taught them to. So the first part of what I was going to teach is the daily fluid intake of 3,000 milliliters. And keep in mind that your content has to be related to your objectives. So you really base your content off your objectives. I have the daily fluid intake is 3,000 milliliters. Then I have egg, cheese, meat, and poultry, whole grains, cranberry, plums, and prunes, acidifying urine, and reduce risk of UTI and calculus formation. So make sure you include content and then the reasons why the patient needs to know that content. So I kind of skipped it on the first one, but you can see it here, A and B. You want to know the daily fluid intake so you can prevent bladder infection and urinary stasis. And then I also have no special perennial care other than normal hygienic care. Showers should also be taken and not baths. And then I have the reason baths can allow bacteria to enter the catheter easily, which can cause infections. And then I also have patients should report impaired catheter drainage, cloudy, foul smelling, red or pink urine to provider immediately. And the reason, which it could lead to a distended bladder, urinary stasis, and bladder infection. Remember, I said the whole point of this is to prevent infection. And then I also have the use hand hygiene during manipulation of the catheter or collection system. And then urine drainage bag should be kept below the bladder level to prevent urine from flowing back into your bladder and not on the floor. And then I also have keep catheter and tubing from kinking and never pull catheter. So on this part, it looks like I sort of included the reason, but on this last part I didn't. So just make sure you include the reason. It's best to kind of put it in the outline format. So I should have had A and put prevent infection and then to also prevent urine backflow and to also allow drainage, because the whole point of the catheter is to drain the bladder, so you want to keep those unkinked so that you can drain the bladder. So I could have just included that here. And also here it's like I still got an A on this one, but it's just some stuff that could have been improved as far as the format and put in the actual reason on each one. But like I said, you don't really want to include this many. Like, I had 3 objectives. As far as my content go, I could have just had 3 bullet points. I mean, you can have more, but like I said, you want to keep it simple. And then after you teach your patient, you come back and you do this part. So you do your evaluation and your reassessment. So you evaluate your objectives. So the 3 objectives you had up here, you evaluate them. First, you put whether the overall goal was met, and then evaluation of objectives, and you put whether each objective was met or not met. Because for the goal, you can have goal partially met or goal not met and goal met. And if you had goal partially met for your objectives, you would have some that were met and some that were not met. And that would mean your overall goal was partially met. So I'm going to just read like one example. So for my first objective, I put met. When asked 2 days later, I put the date. Patient was able to state that he needed to drink 3,000 milliliters a day to help prevent infection. So it doesn't have to be that specific. You could, like, if you were actually teaching your patient this, you probably would ask them, like, what do they usually drink out of? And they may say, oh, I use a big gold cup. And then you can tell them you need to drink about 3 of those a day. And then if they're able to say that back to you, then you know your objective was met once you reevaluate them. When you evaluate your objectives, you just put whether they were met and the proof of why they were met. So you put that you asked them and what the patient stated. And it's best to have quotes. So it's best to always have patient stated when you're evaluating your objectives. And I'm going to just leave this one here, so if you want to read it, you can look it over and pause the video and read it if you want. And then lastly, for the reassessment, this one has quite a bit of sections, but you put data. So you put like new data about your patient. So you will put patient asks questions to clarify steps and repeated fluid intake, amount, acidifying foods, how to care for catheter, and empty collection bag. So you, in your data section, you really just put what happened when you taught him and after, when you tried to evaluate him, like the overall situation. You'll put it here. Revised presentation. So any changes you would make to your presentation, I could have been more organized when explaining information, and I put how I can be more organized. So I need to create some sort of flow chart so it is easier to teach. So you can just put what you could improve and how you could improve it in this section. And then for your topic, you put whether it was appropriate or not appropriate. So I put appropriate because this was the first time the patient received a catheter. So as far as your topic goes, you can put appropriate and then you can link it to the need for teaching. You just link those two, topic and need for teaching. And then for the need for teaching, they basically have a whole thing all over again. And then you put whether it was appropriate or not. And it's essentially the same reason. Appropriate since patient had no previous experience with catheters. It's the same as like this was the first time the patient received a catheter. But you put whether it was appropriate or not. And it says information about group and learner. Basically, you put what the patient stated after everything or during the teaching. So patient stated, I really appreciate you explaining everything to me and answering all my questions, suggesting the teaching strategies were appropriate. So this also includes whether the teaching strategies were appropriate. And then learning readiness, patient stated, please teach me everything I need to know so that I can get well and ready. So this is essentially the same exact thing I put in the beginning. So you can do that as well. And then were the references appropriate? Kind of, appropriate, supply needed information, kind of self-explanatory. Like, yeah, they were appropriate. They helped me complete this. And then for your goal, you put whether it was appropriate and why. Appropriate since this is the first time the patient has had an indwelling catheter and is now knowledgeable on how to care for it. So you put like the need for teaching and then what happened after the teaching. And then you have to evaluate each objective again. And instead of putting whether the objective was met, you put whether you want to continue using that objective or delete it. So for my number one objective, I put continuation because patient needs to continue to demonstrate knowledge of adequate fluid intake amount. For this one, you could also put delete because he did tell us how much fluid he needed to drink. So you could either put continuation because it's important essentially, or you can put delete because the goal was met. And this is what I put for the second ones. I put goal can be deleted since patient demonstrates knowledge of appropriate foods to eat and is knowledgeable of the reason to eat those foods. So you put deleted, what they did, and why it should be deleted. And goal can be deleted since patient has demonstrated knowledge of cleaning care when to contact provider and drainage bag emptying. And then remember, like this reassessment box, it literally reassesses every section of the teaching plan. So you evaluate whether the teaching strategies were pertinent or not. So all of mine were pertinent. I'm gonna just read the first one. It says pertinent because it allowed the patient to have privacy when discussing catheter care. Remember, my first teaching strategy was a one-on-one discussion. The last one was the visual aids. And so it was pertinent, allow patients to have a reference when at home to reinforce teaching at the hospital. So you can actually use that. You can take that like word from word almost and apply it to your teaching plan. The learning activity. So after one-on-one discussion, patient was able to verbalize the amount of required fluid in acidifying foods and their purpose when asked. You literally evaluate each one of your learning activities. So you would go back up to your learning activities section and you would evaluate each one. So you evaluate what the patient did and whether it was effective, whether it was appropriate. And just essentially what happened. Patient was able to demonstrate appropriate hand hygiene, emptying of collection bag properly, and observed holding, tubing, and removing kinks. And then the next one I put, patient asked clarifying questions about bowel and bladder brochure, including, so what do I do if the catheter is pulled out? And how will I know if the tubing has sediment? This providing opportunities for clarifying and teaching. And then you evaluate the content. So the content, you just would put what you decided to do with your goals and basically what you could have improved. So this was the revised presentation. So you would include what you put for the revised presentation and just an overall decision on your goals on whether they should be kept or deleted or whatever you decided. And why in the future to make teaching more effective. So thank you so much for watching. If you found this video helpful, please like, comment, and subscribe. And then if you have any questions, feel free to reach out to me. Just comment below. I definitely will get back to you and do my best to answer any questions you have. And just read the description box. I'll include some more pages for you to reference about this as well. So just thank you so much for watching, and good luck, future nurses.